Cash, behave.
One of the things I loved about meeting Cheryl and Dave here at their facility was their love of their dogs, and that their dogs are, if you don't like dogs, you just probably aren't going to like it here, and that's okay.
That's true.
But I love dogs, and I love their dogs, and maybe one day I'll bring one of my dogs over here to hang out with their dogs. We'll see. But thank you, Cheryl. That was an amazing introduction. Thank you. I'm just so glad you're all here today. I know that in the middle of the day on a Saturday, especially the day before we're supposed to get another snow event, sounds like it's challenging. So I appreciate you all being here, and I hope it's worth your while, and that you didn't feel like this was a waste of your time. My name's Wendy Enneking. I know this is not a common name. No one in this country seems to be able to pronounce it correctly. The first time I heard somebody say it correctly, just as if it flowed off their lips, was in Holland at an airport, and I thought, these must be my people. She just said, Wendy Enneking, and I was like, oh, here I am. I don't think I have any Dutch blood in me, but perhaps. And recently a gentleman said it correctly, but he said he studied linguistics, and he assured me it is phonetically correct. So now I feel like I have more ground to stand on. It's not that hard, it is phonetically correct. So if you took phonics, it should work out, but I do know it's kind of a challenging thing to say. I currently, as Cheryl said, I work most of my life in Midway at the Midway Center for Integrative Medicine with the very brilliant Dr. Jim Roach. I also broke away recently and opened Intention Health and Wellness. Currently, it's a small practice in Georgetown, Kentucky, pretty much one day a week. And then Dave and Cheryl approached me about maybe expanding over here to Louisville, pretty minimal hours to start and see what happens. And I think that's going to be a wonderful opportunity for me, for them, and for hopefully all of those of you who live over here in this part of the state. And the reason, some people are like, well, are you still Dr. Roach's? Why did you break away and do your own thing? Dr. Roach wanted to get away from doing hormone replacement therapy, and that was a big part of my patient population. And it wasn't all my patients, but I was concerned that I would lose a lot of those clients if I wasn't able to offer them those services under his roof, if you will. And he also pays a big part of my paycheck every month. So I thought, well, I still need to honor and respect his practice and his wishes for his practice. But since I'm not in his practice 5 days a week, I thought, well, that 5th day I can open up my own shop and continue to provide care for those individuals. So I did, and so far it's been a good decision, and it hasn't seemed to conflict with his office or what I'm doing there, because I'm still busy over at his office and still bringing money into his practice. So I think he's all on board with that. No PowerPoint slides today, so I hope nobody's disappointed by that. I've been in PowerPoint hell literally for about 2 weeks on another presentation, so I just kind of rolled in here today and I said, you know what, I'm just going to talk to you all in my most genuine, authentic way, which I think most people appreciate, and tell you a little bit about what I do and why Dave and Cheryl thought I would be a good asset to their business here, and also for all of you in terms of maintaining and promoting excellent health in your lives. I am a nurse practitioner. And I've been a nurse practitioner. I took my boards back in 2013, so becoming a nurse and a nurse practitioner was actually a career change for me. I started my grown-up adult career in the world of broadcast journalism. So I was a news girl on the news every night. And I'm from the West Coast. I grew up and was raised in Southern California, Los Angeles more specifically. I left there when I was 25 to a small town in Oregon to start working on my dream to become the next Katie Couric. So we always have to start in a small market, pay your dues, make no money, and pray that your parents will help you pay your rent every month. So I did that, and it took a few years, but I realized this was not an area I was passionate about, and I had actually studied pre-med in college early on, and I realized that was probably an area I wanted to go back to. You get into college sometimes, and you like college a lot. And you experience all of the social things that are involved with college too. So I changed majors, majored in journalism, minored in biology, went down the journalism path for 10 years, left Oregon to Kentucky strictly on a whim. People say, how did you get from the West Coast to Kentucky of all places? Literally had no reason to come here, opened up a map with my husband at the time, said, let's go somewhere, where should we go? And we literally just kind of threw a dart at the map and said, let's go to Kentucky. So came here with no job, no home, and only the assumption that I was going to go into the field of nursing. So applied to the University of Kentucky and drove here with my acceptance letter and no plan. Knocked on all the TV stations cold one day after we arrived, and one of them offered me a job to sustain me while I went through nursing school at the University of Kentucky. So it was a big life risk, a really fun one I have no regrets about, because I think that's what life is about. You have to get out of your comfort zone and go. So we went. And I've been very happy here. It'll be 11 years in May that I've been here. Worked as a nurse at the University of Kentucky, one of the ICUs, which is a great experience because people at the University of Kentucky, just like at the University of Louisville, are very, 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 very sick. So as a bedside nurse in the critical care setting, you learn a lot. And you also learn a lot about what we can do to our bodies if we don't take care of our bodies, because most serious illnesses are actually preventable. I then had moved to Midway, and I went past Dr. Roach's office, and I saw that sign, and I thought, well, I wonder if he's taking students. It sounds like an interesting place to be. So I just reached out to him. He said, yeah, come on over. So I hung out with him for 6 months of my nurse practitioner program, and then he hired me on. So I just sort of fell into integrative medicine. It wasn't like I went to nursing school and said, I want to do integrative medicine. It's just where I landed, and I believe that life happens, everything in life happens for a reason. And so there was a reason I was led to Midway. There's a reason I showed up in his office. So, and it's all worked out very well. And it's an area that I really enjoy because people don't come to our office looking for a medicine to lower their blood pressure, medicine to lower their cholesterol. They usually come to our office saying, my doctor put me on this medicine to lower my blood pressure. What can I do to get off of this medicine? The doctor gave me a medicine to lower my sugar. What can I do to get off of this medicine? So that's really enjoyable because we're blessed that we work with people who are actually invested in taking some accountability for their health. So much in conventional medicine, people are living a lifestyle that is not conducive to long-term health, and eventually, as great as Western medicine has been for so many of us, and I never want to dismiss anything about Western medicine, our toolbox runs dry eventually, and so at some point there has to be personal accountability to take care of your own health. And so it's really a blessing to be in the practice that I'm at because people do want to be healthy for the most part. Of course, we still have conventional patients. I just had one recently. Thankfully, he's a sort of a friend of the practice and someone we've all gotten to know. But this is an individual that I feel like kind of fulfills our Kentucky stereotype in terms of blood pressure, blood sugar, obesity, all of the things, and wants me to offer him more guidance with blood pressure. Well, guess what? The box is empty. And so then comes the tough love on, sometimes I can be tougher. If I get to know you, I might be really tough on you, but I feel like Dave's kind of that way too, probably Cheryl too. Because some of us need to be, sorry.
I noticed the nods.
Right, yeah. But we do have to, there are simple things we can do in our lives to be healthier, but eventually, yes, my tools for him from the Western medicine, allopathic medicine, have run dry. When you're maxed out on every blood pressure medicine that you can safely take, you have to stop and do something else with your life. You can't continue to go down that road. Something that I do, like what Cheryl said, with integrative medicine, the beauty of it is we actually have conversations with our patients. We don't have a quota of 30 patients a day and 10 minutes a piece and go, 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 go. What are you taking? Great, let's refill it. Is it working? Are your vitals okay? Is your sugar okay? Let's just keep taking what you're doing, and no guidance on lifestyle, no guidance on diet, no guidance on anything you can do to hopefully come off of some of those medicines. So that's really something enjoyable, and what most people like is because we don't just look at what diagnoses you have from a medical standpoint, but we try to get deeper into why you have those diagnoses. What's going on with you? Is it your diet? Is it something going on in your life, your stressors, everything. When you see me, I look at everything that you're taking, your medicine, your supplements. We go through why are you taking it, how long have you been taking it, when were you diagnosed with this problem, who's treating this problem, is this the best remedy for this problem? It might be, or it might be right now, because I'm going to meet you where you're at and hopefully progress from there. So we might not be able to say, okay, well, lower your blood pressure medicine today if you do X, Y, Z. It might not be that easy. You might have to say, okay, start making these changes, and then let's come, start weaning down off of medicine. I'm pretty conservative with that. I'm not somebody who just goes in and says, okay, take this supplement, you can get off this drug, this supplement, you can get off this drug. It's not that easy, and that can, quite frankly, be kind of dangerous for you. So I try to do things safely. We definitely talk about nutrition. Nobody's perfect. Nobody's perfect on nutrition. But most of us do a whole lot better than we're doing. It's hard in this country. I don't think we are set up for success, so we have to work harder at it. There are places in the world that have tighter regulations on the food quality that's presented to the population, and there are places in the world where lifestyles are set up in a way that we don't feel like we're constantly trying to just eat as we go, eat in the car, eat what's convenient, eat what's quick. You know, if you go to other countries, sitting down and dining with your friends is an experience. And it's not just about eating the food, it's about enjoying each other and being in a peaceful state when you eat that food and enjoying that food. And all of that has a role in how our bodies digest it, how we get the nutrients out of it. So we definitely talk about nutrition when you come see me. We talk about your relationships, whether those be professional or interpersonal. I am not a therapist. I always say to my friends who with the road of psychological health, I'm like, I don't know how you all do that. It's not my jam, but it comes into play. You know, if there's something, an interpersonal relationship in your life that's causing stress, and I can't necessarily fix that, but I can help you find strategies in my toolbox to hopefully help your body not react so severely to it. Career, sleep, all of these things play a role in your health. Again, that's the beauty of integrative medicine. And I skipped over what I wanted to say at the very beginning. The definition of integrative medicine. Now, this is from Dr. Andrew Weil, who's sort of, if you think about integrative medicine coming to the forefront in the United States of America, Dr. Andrew Weil is kind of a big name out there. He started the integrative medicine program at the University of Arizona. And their definition is integrative medicine is healing-oriented medicine. So I like that, healing-oriented. It's not defensive medicine. Western medicine, as Cheryl said, is sick medicine. You go when you're sick. You come to integrative medicine because you don't want to be sick or you want to be well. It takes into account the whole person, including all aspects of lifestyle. It emphasizes the therapeutic relationship between practitioner and patient is informed by evidence and makes use of all appropriate therapies. So integrative medicine does not dismiss conventional Western medicine, and it is truly a team approach. It's not just the person in the white coat, Cheryl made me wear this, saying you have to do X, Y, Z. It's the two of us having this conversation and deciding, okay, well, if you can't do this, what can you do? Supplements, for example. Supplements can be great. Supplements, I think, can also be a detriment for some people. Some people take so many supplements. I flipped through their list, and it's like 3 pages long, single space. I'm like, number one, how do you afford this? Number two, how do you have the time to take all of these? And number three, how do you not puke every time you take all these? So, anyway, people can get carried away. I'm serious, right?
We've seen it. I got health intake form too. And
Yeah.
so I've had people bring me in a completely different notebook.
Yes, yeah. So, I think moderation is key in taking what you know you need. And there are some things that we know we all need because we're just not getting it from our food or from the sunshine. God willing, it comes back to Kentucky. Things I'm not convinced it's ever coming back. So there are things that I think our bodies truly need that we're just not able to obtain in our day-to-day lives in terms of what we're eating. So I can't remember how I got off on that tangent, but in terms of collaborating with you, which is the definition of integrative medicine. Something else integrative medicine I think offers that a lot of people like is our testing modalities. When you go to a conventional doctor, they're going to look at a CBC, which checks to make sure you're not anemic, make sure you don't have an infection, checks the different indices with your red blood cells that you don't have anything like a leukemia or lymphoma going on. They're going to check a chemistry panel. That's your sugar, your electrolytes, your kidneys, your liver. They're going to check cholesterol. They'll probably check one marker of a thyroid panel, and that's going to be your thyroid stimulating hormone, and that's going to be the end of the line. Maybe a T4, maybe not. And they're going to maybe listen to you a little bit, and you're, especially now I'm going to kind of go down the path for the ladies here, because this is what happens to women in conventional medicine. All their test work is normal, everything's fine. Doctor's going to give them, they're going to maintain thyroid as long as it's within normal limits, but that woman's going to say, my hair is falling out, my skin's dry, I'm eating chicken breast and broccoli every single day, and I'm exercising with Dave 4 days a week, and I'm not losing any weight. And the provider then says, well, are you depressed? Are you anxious? Can I get you an antidepressant? Maybe some Motrin, maybe some something. So that's where it stops with conventional medicine. It makes me crazy because there's no further digging. Is the thyroid optimal? Normal on paper is one thing, but we don't all fit in with a normal, what's normal. When a lab value is normal, that's because the lab has set these ranges based on the average for most people. But not everybody fits in that box. So if I'm looking at a woman and her body temperature is 96.5, she's not able to lose any weight despite a healthy lifestyle. And she has all these other issues going on, and we're going to look deeper at that thyroid. We're also going to look at hormones too. And men, you look at your hormones as well. With men, The media makes us think that testosterone is all about libido, and that's it, or your size of your muscles. If you're a guy who tends to be a little more anxious than than we perceive men should be, you know, it's girls who are the ones who are just all the time. Guys are supposed to be chilled out. If you can't sleep, if you don't have that confidence in your job, I've had some men literally tell me, I mean, these are CEOs, and they're like, I feel like a fraud every day I go to work. Well, it's probably testosterone. Nothing to do with how well you perform with your partner at bedtime. It's all about how you feel as a person in terms of your confidence, and not feeling anxious or not able to sleep. So if you're a guy and you have some of those issues and it's never been explored, it can certainly be explored through the routes with integrative medicine. So that's another thing with the testing, is we don't just do those conventional tests. We offer things like hormone testing outside of the normal realms of a blood draw. I brought some brochures for a company called, they have a test called Dutch Test, it's Precision Analytical, they're a West Coast-based company. They look at hormones through the urine. They look at, there's another company called ZRT, it looks at salivary hormones. So these are non-conventional modalities, but the folks that specialize in hormone replacement therapy, they have found that these are the modalities that are most effective and more accurate in terms of checking the hormones. Cortisol, we're Americans, we're on the go all the time, we don't sleep, we're stressed, and so a lot of us have sleep issues. A lot of women after menopause carry that weight in the middle. There's a lot of reasons for that. It's not just the hormones that you lost in menopause, it could be cortisol as well. So we think about things like adrenal function or dysfunction. So that's a neat thing about when you come into the integrative medicine realm, is just the offered, I always call it the exotic test. You can test for food sensitivities, all kinds of things. We can test for mold in different ways. Trying to think. Organic acids. Organic acid testing looks at metabolites in your urine that can tell us about neurotransmitter function. Your neurotransmitters are things like your serotonin, your dopamine, the things that make you happy or sad. Cellular energy, like mitochondrial function or dysfunction. There's all kinds of things that can be looked at that you're not going to find in a Western medicine setting. Again, we talked about supplements. When I go through, if I have a new client who's never been introduced to supplements, I try to be really conservative. There's the big things we like everyone to take: vitamin D, probiotics. I love magnesium for everybody. And I think when most people get on magnesium, they never want to come off of it. Usually an omega, like fish oil, and often an anti-inflammatory like turmeric. But then we also look at different symptoms, like if somebody with depression, there's a lot of botanical support we can use for depression. There's a lot of botanical support we can use for anxiety. So we look at some of those different issues. Or guys with prostate issues, enlarged prostate, things like zinc. So I try to do just a foundational protocol until we get more data to back up doing other things. Because again, as the definition of integrative medicine states, having science to back it up, having that data, yeah, you can go out and take 25 supplements. I don't care, it's your money. But you know, is it something you really need? Or if you take it, do we see an improvement on your lab results? Do we see an improvement in how you feel clinically? So I think that's all really important. Follow-up. After we get all this information on you, we start a regimen, we start a protocol, and then again, we want to follow up. What can we tweak? What's going well? What isn't going well? Are you following the protocol? If not, what are some of those obstacles? You know, is it your lifestyle? Is it your kids? Is it your husband? Is it your wife? What's going on? What can we do to make you more successful? And again, not trying to put pressure on you. Nobody's perfect. Let's say you're a smoker. I know one provider I worked for, he wouldn't even give you the time of day if you were a smoker. I'm like, that's not okay. What can we do to help facilitate your effort to succeed at smoking cessation? So again, trying to meet you where you're at. And referring to other specialists. As a nurse practitioner, I never hesitate to refer if it's beyond my scope, beyond my knowledge base. If it's something I just don't know, or if I saw in the lab work, wow, you're kind of an autoimmune mess. Well, I can work with you from the integrative standpoint on autoimmune, but it might not be a bad idea to go talk to a rheumatologist. Depending on the severity of your disease, maybe some of these medicines will work for you. Now, those are big, when we deal with that realm, the rheumatology realm, those are big time drugs. Those are like your chemotherapy type of drugs, immunosuppressants. So a lot of people don't even want to go there, but it also depends on their experience and how they're walking through that disease process and their ability to make changes in their own lifestyle. I have a lot of autoimmune patients, they might need the Humira or the Remicade temporarily if they're in a flare, and then they come off of it. So, you know, we try to, again, work with those individuals. We don't dismiss those individuals because, oh, you're on that big bad, you know, biologic. You can't play in our playground. No, that's not true. You can join our sandbox. If you have neurological issues, I'm probably going to at least send you down the road of neurology to get some more data, get more information, get some scans. Heck, if we're seeing you for one thing, just nutritional counseling, but you're like, I had a lady this week, same age as me. She's like, I tried to show my son how to skateboard the half pipe. I'm like, you did what? And she's like, yeah, I hurt my ankle. So I mean, I'm going to refer you for an X-ray. If I already have known you as a client, I can get you that X-ray if you need it to make sure you don't have a fracture. But it's funny because we do have a lot of individuals in this integrative realm. They don't see normal doctors, but sometimes they need to go into that world. If you broke your ankle, you might need to go down the, yeah, I don't have an herb to fix your broken ankle, let's face it. Most integrated providers don't deal with conventional insurance companies. Now, when I'm in Dr. Roach's office, a lot of people come, we still take a lot of, well, I should say we don't take very little of the insurance. Now, this year, he has just weaned off of most conventional commercial insurance policies. He still is with Anthem and Medicare, some Medicare, not all. And a lot of physicians who have taken conventional insurance for a long time have started going in that direction. Reimbursements are lower. I get it from the business standpoint. And often those of us who have commercial insurance, we're finding more and more that our insurance doesn't cover a whole lot. We still have high deductibles just so we can afford the monthly premiums. Or we go to the pharmacy to pick something up and see how high it costs. So a lot of people use flexible spending accounts, or they're just fine to pay out of pocket for services because they have to pay anyway if they go to a conventional office that accepts insurance because the deductible is so high, so they know there's an out-of-pocket expense associated with it. Lab work is often covered by insurance if we have the appropriate diagnostic code. So when I say lab work, I mean the conventional things like the thyroid, the basic blood counts, hormones through blood work, anything you go to like a lab for or a Quest lab, usually we can get insurance to cover most of that. Compounding. I don't know if you're all familiar with compounding pharmacies. I work with a lot of compounding pharmacies, especially when we get into hormone replacement therapy. We think that's, meaning most of us in integrative medicine, we think that's I don't know if I want to say safer approach, because hormones are hormones, whether they're bioidentical or synthetic, in terms of you still run a risk with different issues when you take hormones. But with compounding, we can individualize the dosing. We work very well with compounding pharmacists. Compounding pharmacists are really great people. They also have that holistic mindset where they want to work with the clinician, work with the patient, and come up with the best strategy. And they can concoct so many things. I mean, I've had a compounder concoct skin stuff for me. They can compound thyroid medication, and of course all the hormones. But really, they have so many things they can do. B vitamin injections, lots of things. One thing I have compounded a lot for my autoimmune patients is something called low-dose naltrexone. Naltrexone is a drug used conventionally for people with opioid dependence. But they have found in low doses, which you can only get low doses if it's compounded, it works well with autoimmune issues. They don't even really understand the mechanism of action for that, but they know since it does work on kind of your feel-good receptors in your brain, that it can alter your brain chemistry a little bit. So hopefully that can help modulate that immune response or how you experience that autoimmune issue. Let's see, what else? I'm trying to think. Does anyone have questions at this point? Because I know I've rattled off a lot of information about. Yes, Cheryl.
No, I was just going to say, I think it's important, a lot of people don't know the difference between doing synthetic hormone replacement versus bioidentical, and I think that's really important.
Right, absolutely. So bioidentical is plant-based, and when they say bioidentical, it's the most biologically identical to your body's natural hormones. Hormones come with risk. The biggest risk, of course, in conventional medicine, they really scare us with the risk-based risk. Of course, we think of a greater propensity towards cancer and also blood clots. Those are the big things. So a lot of women are like, whatever you do, don't put me on hormones. No, not everyone's appropriate for hormones. If you're a woman and you have some suspicious things going on in the breast tissue, and you're like, I just had a lumpectomy, it wasn't cancer, but I have a strong family history of cancer, we might be a little more conservative and try to find some other strategies for you to alleviate the discomforts that can come with menopausal transition. But I was at a conference recently, and this is a big hormone expert from the Institute of Anti-Aging Medicine, Dr. Pamela Smith. She said, it was so profound to me, she said, hormones are not giving people cancer, sugar is giving people cancer. And I was like, And it's true. The foods that we're consuming in this country are driving inflammation really high in our bodies through lots of issues in our guts. You know, people think, oh, my gut's healthy, I have a bowel movement every day, no problem. It's so much bigger than that. Bacterial imbalance in our gut in terms of the healthy bacteria, and also impairments in our gut lining. That's a phenomenon more simply known as leaky gut. And that's driven by the foods that we're eating, our lifestyle, our stress, hormone imbalances. But yes, so the bioidentical hormones, you can tailor the dose more. They're more biologically alike to our body's own hormones. Synthetic, you're going to get steadier doses made in a factory, but again, it's synthetic, so it's not exactly like what our body is making on its own. Hormones are challenging but fun at the same time, because when you get somebody optimized and feeling great, it's wonderful. But when I do have individuals on hormones, men and women, I am fairly strict on the follow-up and the screenings. My guys, I make them go get their blood drawn periodically, because testosterone can actually make your blood thicker, and you might have to go donate blood to thin that out a little bit. So if your blood is thick, I always think of ketchup versus water running through our vessels. The ketchup's going to be more prone to blood clots and strokes, things like that, where the water's going to flow freely. So a lot of my guys on testosterone, they go donate blood periodically. If they can't donate blood, let's say they, been to sub-Saharan Africa or something, the blood bank doesn't want their blood, they can pull the blood off of you, but they throw away your specimen. And I've had women say the same thing, where they're like, well, I need to donate blood, but I can't. Like, they might have a hereditary issue that causes their iron levels in their body to stay high. You can still go donate blood, it just does not go into the donation pool. The blood bank or the blood center will pull it off of you and then dispose of it properly with a provider or physician or nurse practitioner. Go ahead.
What kind of tests would you run to see and would do that?
So often we start with a food sensitivity test, because the proteins that show up on that, or the foods that show up on that test, are based on proteins that are encountered in the laboratory. They expose proteins from that food to the proteins in your blood specimen and see what reacts. We don't do, a lot of the food testing in integrative medicine is not IgE. So IgE antibodies are those ones that come in right away. Like if you get a bee sting and you need to go to the emergency room, that's that IgE antibody. A lot of food sensitivity testing is done looking at IgG antibodies. So IgG antibodies come in like after the IgE has already taken place. So, for example, some people have an anaphylactic reaction to peanuts. We might do their food sensitivity testing, not a food allergy sensitivity testing, and it says, oh, you can eat peanuts. Well, they know they can't, because they know if they eat a peanut, they're going to be in the emergency room. But that IgG antibody is almost like it never has a chance to react. It's all IgE for them. So we start by doing that, identifying which foods have driven that leaky gut phenomenon. And then,
Did you have symptoms?
that's the thing. The symptoms can be very insidious. You might not have symptoms that you're seeing every day. Like, some people have dairy intolerance, and they know it. They feel bloated after they have milk, things like that. To me, food sensitivity symptoms can be expressed by skin conditions, just sometimes a general puffiness, inflammation. They can be bloating after certain foods. It can be sinus buildup. I know for a lot of people, dairy, that's what, if I eat too much dairy, it's all up here for me. I feel like my eyes are about to pop out of my face. So sometimes it is a little bit more insidious. Or sometimes people realize, wait a minute, if I eat really great for a few days, I feel so good. And then if I eat my normal day-to-day thing, I feel badly. I have a lady with rheumatoid arthritis, and she knows when she eats sugar, she gets that flare. Or when people go on vacation, they go on a cruise, and they eat everything, all the things. They feel terrible. I'm around the holidays is when I feel bad. Thanksgiving makes me feel like I have the flu for about a week afterwards. Just because that stuff doesn't live in our house. When do you have Thanksgiving food in your house any other time of the year except Thanksgiving? I mean, I hope you don't. You all would like to know. Who has stuffing or the stuff to make stuffing in their house any other time of the year? So that's kind of how we start identifying. We often, though, just assume everyone has leaky gut. If you're an American and you eat the American diet, you probably have leaky gut. So our efforts to heal the gut, eliminate foods that we know are common mediators of inflammation, and then go through and think about things that are going to seal up that gut lining through supplementation, and also populate the gut with really healthy bacteria. That's the things we do. And keep things moving. So many people in this country are constipated, especially women. They just hang on to everything, I think. guys are like, oh, since I have my morning coffee, I go to the bathroom. Like, how do you do that? So, yeah, but it's true, right, you ladies?
Yep.
Yep. Nobody does that enough. So my role here is pretty much gonna be like my role when my office in Georgetown I opened is instead of like a doctor's office. I call it my conversation space. It's a really cute space in downtown Georgetown where you just come in and we sit and we talk and we order testing and we go through treatment regimens. And that's kind of how it's gonna be here too. I'm gonna be in Cheryl's massage space and same thing. We'll sit, we'll have a nice long conversation. We'll look at what you're doing, what can we modify, what can we add to, what testing can we order. I'm not gonna be set up to draw blood here. It's not something that really interests me to do that at this point, but I can send you to a lab with an order and get that work up for you. And if there's testing that you've run across in your research and I don't have an account with, it's usually pretty easy for me to open accounts with some of these testing companies because there's dozens and dozens of them. And you know, as a provider, you have to kind of choose, who am I gonna open an account with? What are my biggest things? So, you know, I open accounts with like the hormone testing, and of course like lab pull requests, things like that. But at some point it just gets a lot to manage. So, but if there's something that you're like, you know what, I was reading this article and this doctor needs to use this company, I can get an account to order for you. What else?
Sure, people are wondering what costs.
Yeah.
Absolutely.
It's great to know what's going on, but how do you get there, what's gonna cost to get there?
Absolutely. Yep.
I want to touch base on that.
Yeah, absolutely. So for me, an initial consult is $150, and I charge $85 for follow-up. So the initial consult is usually 45 minutes to an hour, and follow-ups can take about the same amount of time. Testing, again, if I send you out with an order just for conventional testing, that's going to be up to the insurance company and what they've negotiated with the lab, pretty much. And then, as far as what I call the exotic testing, my hormone testing prices range anywhere from some hormone testing are just under $100, and some go up to almost $300 or $400, depending on how much in depth you go. Like that Dutch test from Precision, the complete, as they call it, it tests all the sex hormones for men and women, and cortisol levels, 4-point cortisol over a 24-hour period, and it has some organic acid. So it's a pretty comprehensive test that people like. But that company also, they have even, like they have a cycle mapping test for women who have trouble getting pregnant, and it's a 28-day test, so it gets a little bit more involved because it's a pretty extensive test. If you're collecting urine for 28 days straight to send to a lab, the cost is going to be higher. So,
What
but
sensitivities, foods, and stuff like that?
food sensitivity testing usually can run in the $200–300 range for that test.
Is that blood work?
The Meridian Valley is a blood work test, yes, for the food sensitivity. And there are other, Cyrex has one, I'm not sure what their costs are because I've not opened an account with Cyrex, but usually that's the range that they're in.
And the patient would be responsible to take care of their own.
Right. Yeah. And I'm set up to do credit cards, flexible spending accounts, checks, cash. If they're on a card, yeah.